ulcers and just tired legs, don't let chronic leg pain put a pause to your daily activities. Treat the problem. Here to explain, please welcome Dr. Carlos Hamilton from the Hamilton Vein Center, along with his patient, Kathy Tucker. Hi there.
Thank you. Hi.
All right, we've mentioned a couple of times today how there are procedures that were done the old way and people were afraid of, but there's now new technology, and that's the case right here.
That's exactly right. And maybe I should just let Ms. Tucker tell her story.
You had vein stripping done before.
I had 30 years ago.
Yeah, which even, it just sounds crazy to me when you say vein stripping.
That's why I didn't think anything else could be done.
Yeah.
Until I got a stasis ulcer.
Okay.
And my doctor sent me to Dr. Hamilton, which changed everything for me.
And Dr. Hamilton, when she says ulcer, a lot of times people think that's like a dermatological issue, not a vein issue, but that is one of the things that happens when your veins aren't working properly.
That's absolutely right. Usually it's on the inside of the ankle. Sometimes it can be anywhere on kind of the lower leg, but the blood backs up in there. There's not enough oxygen in there. The tissue breaks down. It just can't heal. And we see people that have had these for years, decades, and they just keep going. And once you treat the veins, they heal up.
Yeah, so what they did before was the vein stripping, which is a long kind of a process and a lot of downtime, right?
Absolutely.
So what do they do today? What did you do for her today?
Okay, so instead of doing the vein stripping, what we do is we go in there with ultrasound and find the veins that aren't working, and then we close those, putting a little catheter in there, very similar to what Dr. Fisher was saying. Put the little catheter in. Instead of putting little beads in, what we do is heat the inside of the vein, and then the veins grow closed, and it keeps the blood from going the wrong way.
Huh. What do you feel when this is happening?
Nothing.
Yeah, nothing. With the little catheter was in there.
Local anesthetic. No pain, no distress, no stress, because the procedures are done in his office. I drove myself to the doctor, drove myself home, never had any pain.
Yeah, and then after the procedure,
nothing.
Yeah, nothing. You just go about your day.
That's it. Even yard work, everything, anything.
Yeah. Did you believe that it could be that easy, given that you went through the craziness before?
No. No, and at one point he was removing a vein from this leg. It's called a phlebectomy. And I had a big tear rolling down my face, and the whole surgical team said, "Are you okay? Are you okay?" I said, "I just feel so grateful to be able to have this fixed." And that's the truth. Such gratitude.
Yeah. Because Dr. Hamilton, that is the issue, is that it stops a lot of people in their tracks, literally.
It absolutely does. I mean, it limits people's ability to walk around, play with their children, their grandchildren. We see people every day that have had to stop working because their legs have bothered them so much. You can treat them and get them back to where they were 30 years ago.
What we're seeing today is that all doctors are not the same, and they're a specialist for a reason. So I want to make this point clear.
Yes.
Not everybody knows how to treat what you're treating, whether it's the restless leg syndrome, whether it's the heavy leg, all those types of things. Not everybody does what you do.
You're absolutely right. I mean, we only treat veins, and that's why we treat more patients. We've done more procedures than anybody in Southeast Texas, and we really focus on that, and you've got to be really good at ultrasound to do it, and just the minimally invasive procedures, and it works great. It works fantastic.
Let's run through some of the symptoms that people may be feeling, or some of the things they may be seeing on their legs, which would indicate it's probably a vein issue.
Sure. Tired, heavy legs, leg cramps at night, restless legs at night are also associated with vein problems. Darkening of the skin around the ankles is a classic finding with this. Ulcers, like we talked about. A lot of people, their feet will turn purple. The people that have their feet turn purple will know exactly what I'm talking about. Everybody else has a hard time.
You see people walking around with it,
and they've got literally purple feet, and then if they elevate them, it goes away. That's because the veins aren't working right. When they lift them up, the blood drains back out of them. So those are some of the big ones. Certainly bulging veins. Bulging veins are not just a cosmetic issue. They mean that there's a flow problem going on. The pressure's increased in these veins, and that's what leads to the skin breaking down. So if they're bulging veins, skin changes, insurance covers this. And the nice thing about this time of the year is that a lot of people have met their insurance deductibles, so frequently these procedures are completely covered by insurance and Medicare. And wearing compression stockings this time of the year is much more tolerable than in August as well.
And the fact is that you don't have the downtime that you used to have, that you can have it done and go back to work, you know, have it done on Friday, go back to work, or have it done and then go back to work the very next day.
I'll tell you what, we treat people first thing in the morning and they go to work. We treat people all day long. They go to the gym right after it. They're lifting, you know, weights, bicycle, jogging, Zumba class, or whatever
My
it is.
favorite is the patient he had, and he calls to see how she's doing. She says, I'm in the mall right now, can't talk to you, got things to buy. Right? So in other words, if you're having any issues with your legs at all, even if it was just aesthetic, so you thought, you can also deal with that type of stuff as well. You can go in for a free consultation to any one of the 4 Houston area locations for the Hamilton Vein Center. For more information, call 281-565-0033, 281-565-0033. They'll let you know the location that's closest to you, or visit their website at hamiltonvein.com, hamiltonvein.com. Thank you, and you have some yard work to get back to, don't you? All right.